All right, let's dive in. We're going to build a no-nonsense guide to one of the most basic but critical interventions we have in medicine, oxygen therapy. Getting this right is absolutely crucial, so let's make it super clear. Imagine this. You're in the ICU. An alarm starts blaring, you look over, and your patient's oxygen saturation is dropping fast. You've got all these different devices on the cart. Which one do you reach for? Because here's the thing. Choosing the wrong one can seriously harm your patient.
So, what's the whole point of this anyway? Well, the main goal is pretty straightforward. We're trying to treat hypoxemia. That's just a fancy word for low oxygen in the blood. See, our cells, especially in the brain and the heart, they need a constant stream of oxygen to make energy. The stuff that powers literally everything they do. Without it, things go south, and they go south fast.
Okay, before we even think about touching a single device, we've got to learn the lingo. And the most important term you need to know, bar none, is FiO2. Now, don't worry about some complicated textbook definition. All it means is the percentage of pure oxygen that your patient is breathing in with every single breath. That's it. Get this, and everything else we talk about is going to make so much more sense. And that brings us to this number. It might seem simple, but it's so important. The air that you and I are breathing right now, it has an FiO2 of only about 21%. That's it. So our entire mission with any of these oxygen devices is to safely bump that number up to whatever our patient needs to stay stable. And this leads us to maybe the most critical concept of all. Seriously, if you take one thing away from this, let it be this. Oxygen is a medication. That's right. It's a drug. It has a dose. It has specific reasons to be used. And giving the wrong amount? That's a medication error. Too little is obviously a disaster, but too much can be toxic too. Okay, let's pop open the toolkit, shall we? We're going to start with what we call the low-flow devices. These are the ones you'll see everywhere. They're the real workhorses of the hospital, and they're almost always the first line of support you're going to reach for. First up is the nasal cannula. This is the absolute bread and butter of oxygen delivery. It's perfect for those patients with just mild hypoxia, the ones who just need a little bit of a boost. You're going to set the flow rate somewhere between 1 and 6 liters per minute, and that's going to give you an FiO2 of roughly 24 to 44%. Now, when you're using a cannula, safety and comfort are huge. You always have to check for skin breakdown, especially behind the ears and in the nose. And here's a pro tip that's super important. If you're running that flow rate above 4 liters per minute, you need to add humidification. Trust me, dry oxygen is really uncomfortable and it'll dry out their nose in no time. So what if the cannula isn't enough? Well, the next step up the ladder is the simple face mask. Well, grab this one, a patient needs a bit more than the cannula can give. Or maybe if they're a big-time mouth breather. Since it covers both the nose and mouth, we can crank the flow rate up to about 10 liters per minute and get a higher FiO2. Okay, now listen up because this is a huge safety point. With this mask, the flow rate absolutely must be at least 5 to 6 liters per minute. No exceptions. And you might be asking why. Well, it's to flush out all the CO2 they're exhaling. If you set it any lower, they're just going to be rebreathing their own carbon dioxide, and that's a big problem. All right, time to bring out the big guns. When you see a non-rebreather mask, or an NRB, your brain should instantly scream critically ill. This is our go-to for someone in serious respiratory distress. We're cranking that flow rate way up to 10 to 15 liters per minute. We're doing that to deliver the highest possible oxygen concentration we can get from a simple mask. We're talking 95% or even higher. And this might be the most important safety check in this entire talk. You see that reservoir bag? It has to stay inflated. If that bag collapses when the patient takes a breath in, it means your flow rate is too low. And what's happening? They're rebreathing their own CO2. They are literally suffocating. This is a non-negotiable life or death check you have to make. So, we've covered the foundational tools. Now let's level up and look at some devices that offer a higher degree of support and something else that's incredibly important: precision. This is the Venturi mask, and I want you to think of it as our precision instrument. Here's a little trick. The V in Venturi stands for very accurate. Its whole purpose isn't just to give oxygen, but to give a precise, exact concentration of it. The magic is in these little color-coded adapters. Each one is designed to pull in a specific amount of room air and mix it with the oxygen to deliver a locked-in, exact FiO2.
So remember, this mask delivers a fixed FiO2. And this is so important for patients with conditions like COPD, because they can actually retain CO2 if we give them too much oxygen. But here's the critical part. For it to work, those little windows on the colored adapter, the air entrainment ports, they have to stay open to the air. If a bed sheet or a blanket covers them up, you've just turned it into a simple mask and completely defeated the whole purpose.
Okay, now for a serious step up in support. High-flow nasal cannula, or HFNC. This thing is a game changer. It can deliver oxygen at crazy high flow rates. We're talking up to 60 liters a minute. But its real magic is in the comfort and the function. The air is heated and humidified, so it's way easier for patients to tolerate. It helps wash out CO2 from their airways, and it even provides a little bit of positive pressure, what we call PEEP, to help keep their lungs open.
All right, so you've seen the gear, you know the numbers, but how do you put it all together? Let's build a really simple clinical framework so you know how to choose the right device for the right patient. The best way to think about it is like a ladder of support. For someone with just mild hypoxia, they just need a little boost. We start on the first rung with a nasal cannula. If they need more than that, we climb up to the simple face mask. And if our patient is critically ill in serious distress, we don't mess around. We go right to the top of the ladder with our high-concentration devices, like the non-rebreather or high-flow.
But wait a minute. Let's throw a wrench in the works here with a critical thinking question. What about that patient with COPD that we keep mentioning? We know they can be super sensitive to high oxygen levels. So if they're in distress, do we still just blast them with oxygen? Is that the right move?
Well, for a lot of patients with COPD who are known to retain CO2, our goal for their oxygen saturation is actually a bit lower. We're usually shooting for a target between 88 and 92%. And the reason is, giving them too much oxygen can actually knock out their drive to breathe. And this is exactly why that Venturi mask is so incredibly valuable. It lets us dial in just enough oxygen to hit that specific target without going overboard. And really, that brings us right back to where we started, to the main theme of all of this. This is the big takeaway. Oxygen is a powerful drug. It has incredible benefits, but it also has real risks. You have to treat it with the same respect you'd give any other potent medication. You have to use it wisely.
So now you have the basic framework you need to safely choose and use these life-saving devices. You know, mastering this stuff isn't just about passing a test. It's about keeping your patients safe. For more deep dives like this, make sure you follow.